The symptoms start out like a cold, runny nose, congestion, and mild cough. But the number of cases of whooping cough are on the rise. And this year could prove to be the worst in Minnesota since the 1940s. To date, there are more than 1,800 pertussis cases. But the Department of Health predicts that number could rise to 3,400 by the end of the year.
Has it been over a year since her previous?
Dozens of phone calls are coming into this Brooklyn Park pediatric clinic from parents concerned about the rise in whooping cough, also known as pertussis.
There's a very big increase in pertussis out there. So far, the best tool we have to prevent whooping cough is the vaccine. It's not 100%, but it's the best strategy that we have.
Named for its characteristic whoop sound in young children, whooping cough is most dangerous and even deadly for children under the age of 1. Doctors recommend making sure your child is up to date on vaccinations, but it's also important for parents, pregnant women, grandparents, and anyone else who is regularly around kids to get the pertussis vaccine.
Across the country, the data shows that only about 8% of adults have. So that's something that we can do to really make a dent in the outbreak.
The pertussis vaccine was adjusted in the 1990s to lessen side effects, but that change in the vaccine may have reduced its long-term effectiveness.
The protection that a person gets when they're vaccinated doesn't last as long.
Still, doctors say the most important thing people can do today is get immunized to stop the spread of this disease.
The less of pertussis that there's in the community, the less opportunity there is for children to get infected.
Keep in mind that adolescents and adults with whooping cough will likely experience severe coughing fits, but it might not sound the same as it does in young children. Getting antibiotics can lessen the severity of the disease and also make you less contagious.